So here are some parameters of pharmacokinetic parameters, which are bioavailability, which is denoted by F value, and the other parameter is Tmax, and volume of distribution Vd, clearance, intrinsic clearance mainly, and plasma half-life. So those are mainly important parameters, which mainly uh, from those parameters we get an idea, overall idea, that how the drug would um, would react in our body, or how the drug would work in our body, human body. So bioavailability, we know that it's a fraction of the absorbed drug in the blood. So from the oral dose, how much dose is absorbed in the blood. So for bioavailability, we need two doses. That means the oral dose and also the IV dose. Those both doses are needed to calculate the F value. So the fraction absorbed in the blood. And you know Tmax. What is Tmax? The time that is needed to reach the drug in the high concentration at the plasma. So in the right side, this is a figure, or typical figure. This is mainly called the plasma time curve, or CP time curve. More commonly it is referred as CP time curve. So volume distribution, you know what is it? Mainly it refers to how the drug is distributed in the body. Like, is it how much of it is in the blood or plasma, or how much of it is in the tissue compartment. So the volume of distribution gives us the idea. So normal range is between 10 to 1000 liter, or if it's converted in the kg, then it gets divided by the average kg. So the higher the value of the Vd, that means the drug is more in the lipid compartment. That means the drug is more lipid soluble, and that means in the tissue compartment. So if the Vd is low, like 5 liter or 10 liter or 20 liter, that means the drug is in the blood. Most amount of the drug is in the blood. So the drug is not that much lipid soluble. It is water soluble. That means the drug is on the plasma compartment if the Vd value is low. So clearance, we know that, like, the drug is metabolized and excreted. So the clearance is the removal of the drug from the plasma by an organ. So how much of a drug is cleared from the plasma by a single organ? That organ could be liver, kidney. So hepatic clearance is a measurement, and also renal clearance is a measurement. By adding together all those clearance, we get a total clearance, which is the CLT, total clearance. And at the last, here is a relationship you can see with clearance. If the clearance is high, that means the T half will be low, and if the volume of distribution is high, that means the T half will be high. So you are getting that right. If the clearance of the drug is high, that means metabolism is high, then the half-life of the drug would be low. And if the drug is volume of distribution of the drug is high, that means the drug is stored in the tissue. That means the drug is not clearing. So because it needs more time to come in the blood from the tissues, so it requires much more time. That means the T half is increasing. So these are crucial interrelations between those interrelated parameters: clearance, T half, PD, T half. So going to the next slide. So we all have some ideal properties what we want from our lead candidate, lead compound. So for our lead compound, which must cross the GI tract, so that it can come in the blood, and it also needs to be stay in the body after it has reached in the plasma. Then it also stay in the plasma for a certain amount of time, so that it can carry out its function, pharmacological action. So if that time is low, that means if the drug is highly metabolized, that means it is not remaining in the blood for a sufficient amount of time. So there are some parameters which is desirable, or ideal properties, which is the drug must cross the GI tract. That means it needs to be some level of permeability should be high enough, to cross the membrane of the GI tract. And when it crosses the GI tract, it reaches the plasma, so that when reaches the plasma, it should be sufficiently stable in the plasma to carry out its pharmacological action. So these are the the desirable properties. Also, toxicity is an important factor. The drugs should not be too much toxic to the intended tissue. The drugs should have less amount of toxicity. So these are the desirable properties. So when we ingest a drug in the oral route, the drug reaches the GI tract, and from the GI tract, the drug is absorbed, right? So the drug is absorbed from the GI tract. So a lot of the factors mainly control or affect this absorption of the drugs. For example, the chemical properties of the lead compound, the formulation of the lead compound, route of administration. That means if that is the oral route, then this will be low. The absorption will be low compared to the IV route. In the IV route, the absorption is 100%. Also, the pH is another important factor. So the pH means the drug must survive the low pH in the acidic environment of the stomach and other GI secretions. So the drugs should not be degraded by those environment low pH or high pH. So here are some factors like the difference in the pH along the GI tract. Those affect the absorption, surface area, per luminal volume of the GI tract, presence of bile and mucus microflora, which is the bacterial environment. Like bacteria can secrete lot of chemicals which mainly metabolize drug in the GI tract. This also could be possible. Intestinal transit time, it is also important factor. Blood perfusion or tissue perfusion, the nature of epithelial membrane, drug formulation. The formulation is another important fact, like crystal formation or salt formation, where the drug is like the hydrate, that means water molecules are involved or not. Likewise, the route of transmission, route of administration, which mainly affect the absorption. Like IV, there is no barrier. If we take in the IV in the blood, that means the intravenous, then there is no barrier in the absorption phase. But if we take in the oral route or intramuscular or subcutaneously, then there is multiple barriers. The first barrier is the skin or in the muscle from which the drug needs to be absorbed. So there's that we have to consider. So potency, which is another important measure for a lead compound. The IC50 value mainly the concentration at which the drug shows its maximum 50% activity. So the lower the IC50 value, the higher the potency. And if a drug inhibits the enzyme, then we can also see the activity of the enzyme. Like if the drug is inhibiting the 50% of the activity of the enzyme, then it is referred as the EC concentration or EC50, effective concentration. Here's the curve, like the dose response curve here. The IC50 value at with the 50% activity, this concentration is the IC50 value or the potency, you can say. So here is the scale. We use a scale like the high the IC50 value, it is safe, the green portion is safe, but the low the lower the IC50 value, it is not safe. That means if that is lower, that means it requires a lot of concentration to reach its 100% activity, right? So the oral dose will be higher in the clinical phase, so which is not desirable. So 1 nanomole or above is safe, is considered good for its potency. So from 1 micromole, nanomole, from 1 micromole to nanomole, it is safe. It is also in the right side. This is also same. These two measurements are the same. But in the right side, you can say this is also a scale. This scale is generated by By incorporating those values in the left side, those values are converted in the logarithmic scale or the log value, so it is more easy to understand. Simple scale of the potency. Like if the value of potency is 1 in this logarithmic scale, then it is not safe. Higher the value, it is safe in the log scale. So moving to the next slide. So lipophilicity, I mentioned that. I mentioned that it is like one of the most important parameter, single most parameter that determines a lot of the properties of the drug. So lipophilicity mainly, I mentioned earlier that the lipophilicity mainly one of the most single important parameter because it determines a lot of important other stuffs. So it mainly determines other properties of the lead compound. Those are mainly interrelated. So what happens if we take a drug? So suppose we took or ingested a drug, paracetamol tablet in the oral route, then in the GI tract there is aqueous phase. Then in the GI tract the tablet dissolves, undergo dissolution, and then from the GI tract the drug crosses the bilayer or the cell membrane and then finally reach to the plasma. In the plasma there is two phases like the organic and aqueous phase. The plasma is composed of serum, the serum is the mainly the aqueous phase which mainly composed of water, and the plasma, the other phase is plasma which is mainly composed of the plasma proteins. So those are mainly organic phase you can say, or the lipid phase you can say. So all of these phenomena, the crossing of the membrane or the dissolution or this partition between this plasma or blood or the aqueous phase, this all can be described by the lipophilicity and some other value like the solubility, permeability, etc. So mainly lipophilicity mainly drives this process.